In recent years, more and more general practices have begun to reap the benefits of using computers. They have more accurate age-sex registers, more efficient repeat prescribing, and provide a more effective way of screening.
Hello.
Hello, I've got an appointment with Dr. Hutchinson.
What's the name?
Mrs. Pauline Johnson.
And what time is it for?
3:45.
Would you like to go up to Dr. Hutchinson's waiting room?
But cost has limited the amount of equipment that practices could afford. It has also deterred many GPs from taking the plunge at all. Now this is changing. AAH Meditel is offering a comprehensive computer system at no cost to the practice. Each doctor can have a computer terminal in their consulting room. This program has been made to demonstrate the use of the computer in the consulting room. Mrs. Grove was seen by Dr. Parry a week ago. She has been suffering from dizzy spells. Her blood pressure was higher than it should have been.
But your blood pressure is still higher than it really ought to be. It's probably this that's giving you the dizzy spells. By the way, how's the family?
Oh, they're all well, thank you, Doctor.
Oh, that's fine. All organized for your holiday?
Oh, just about.
Where is it you're off to again?
Yorkshire.
Yorkshire.
We'll stay at Granny's.
I had a relative come from Yorkshire.
Yes.
Yes, a great-grandfather.
Oh, yes. What part was that?
I knew you'd ask me that. I can't remember.
No. I come from East Yorkshire.
Very nice, but nippy in the winter, isn't it?
Yes.
Well, we've talked before about your weight and your smoking. Now, I know you're doing your best about these, but we've really got to do something to bring your blood pressure down now. So, I'm going to give you some tablets.
In this consultation, Dr. Parry needs to be aware of possible adverse reactions, contraindications and sensitivities. Before the installation of the computer, the doctor needed a well-ordered and summarized set of notes and reference books. The doctor needed to know what was appropriate, what was available and was safe to prescribe for a particular patient, and to write on the FP10 and record the issue in the notes. Using the computer, the doctor produces a prescription that is automatically checked and printed quietly in the consulting room. All this is done with a minimum number of
Very
keystrokes.
well, actually, Doctor. Thank you very much. Yes, she'll be doing grade 4 next.
Grade 4?
Yes. Yes, her daddy and I are very pleased with her.
Is your son musically inclined?
Oh, no. He's quite a different cup of tea, Simon.
What's his interest?
Football.
Ah,
In the
yes,
great
of course.
outdoors. You know, anything outside. Yes.
How's his knee coming along? He hurt it, didn't he?
Yes, he did. Yes, it's a lot better, thank you.
Oh, that's
We
good.
don't have to go to the hospital anymore.
Oh, that's marvelous.
I can't wait to be back outside, chasing after a ball.
I loathed it.
Did you?
Always wet and cold, very healthy, but I didn't enjoy it.
No, I'm sure I wouldn't.
No.
I was no good at sport at school at all.
Well, we're all made differently, dear.
Yes. Oh, excuse me, Doctor. When do I take the tablets?
First thing every morning with water.
Yes.
There we are.
Thank you very much, Doctor.
Thank you, Mrs. Grove.
Mr. Peter Longmore, please come to room 4.
Mr. Longmore has had a dermatological problem from childhood. He has been referred to outpatients clinics on a number of occasions. Some treatments advised have been temporarily effective. Others have been associated with adverse reactions. He has been treated by a number of different doctors at the practice, but Dr. Greaves has not seen the patient before. She is trying to piece together a history, searching both notes and letters.
When did you say you last came in?
About 2 months ago.
Yes. Yes, but wasn't that with your throat?
That's right, Doctor, yeah.
No, what I meant was, when did you last see anyone about your hands?
Oh, about 6 months ago.
Right. Think I've got it now. Okay, let's have a look at your hands.
No matter how well ordered the notes in a Lloyd George envelope, it is quite often difficult to find exactly what you're looking for. The Abies software structures a patient's computer record in a way that allows easy and rapid access to the particular piece of information required.
Yes, it cleared up very quickly.
Good. Okay.
Here we have a chronological listing of encounters, the journal.
Over 6 months since
But
we
with
last
only
saw you
2
about your
keystrokes,
hands.
Right.
you can display all the encounters pertinent to a particular
Yeah,
problem.
but the hospital gave me some cream, and that seemed to work until recently. Now they've flared up again.
Let's have a look at them. When did you last use the cream?
Well, I started using it again about 2 weeks ago. I had some left from the last time, so I thought I'd give it a try.
Has it helped at all?
Well, only a little.
Only a little.
Yes, it doesn't seem to work as well as before. Anyway, it's run out now.
Yes, I would have hoped for more progress, but these complaints can take some time to clear up. Now, you've been using the cream recommended by the consultant.
Yeah.
I would like you to try it for just a little longer. But if there's no improvement in a week or 10 days, you must come back and see me.
All right, Doctor. I'll give it a try. It did work before, thank you.
Good. Okay. And you haven't any of the cream left?
No, none at all.
Right. I'll give you another tube.
Okay.
You haven't changed your job recently, have you?
No?
So you're still at the engineering works?
Yes, I am.
And you're probably involved with oily components, cutting oils, those sorts of
yes.
things.
Yes, quite a lot at the moment.
Well, it would help if you could wear gloves when you do that, and wash your hands well afterwards. But avoid detergent cleaning agents if possible.
Right.
Anyway, until the rash is gone, use this cream 3 times a day. First thing in the morning, when you get home from work, and then again last thing at night.
Right, thank you.
Using the computer in the consulting room is less intrusive than trying to use Lloyd George notes effectively.
So let's hope that does the
The
trick.
patient's medical history is presented in a much more orderly way,
Yeah.
Thank you very much.
allowing you
Bye now.
speedy access to the information you require.
Well, Max, we'll soon get rid of that.
It also
nasty
helps the
old sore
practice
eye.
to carry out its
Now,
preventive
what I'm gonna do is
programs
I'm
more
gonna have the
effectively.
money to go along to the chemist and get some very special eye drops. That should clear it up within 48 hours completely. But if it
Yes.
doesn't, I want you to bring him right back and see me again.
Okay.
Fine. Fine. That's for you, Max.
Thank you very much.
Ah, now I can see that he's due for his measles vaccination.
Yes.
Look, could you bring him back and see me again in 2 or 3 weeks' time?
Fine.
Good. And how are you feeling, Mrs. Johnson?
Oh, I'm feeling all right, thank you.
Good. As you know, there are 1 or 2 things we like to keep a check on with all our patients. Well, blood pressure, smears, smoking and so on. So while you're here, I'd like to have a quick look at your records, if that's all right with you.
Yes, that's fine.
Good. You all right, Max?
Nice man. Yes?
That's good.
Yes, thank you.
Ah, yes. Now, you see, you had a smear test and checked your blood pressure about, 6 months ago now. But I've got no record of whether or not you smoke, do you?
Yes, I'm afraid I do.
About how many?
15 or 18 a day, that's all.
15 or 18, okay. There we are.
I really have tried to give up, but, I'm finding it so difficult.
Well, look, what you could do is, if you make an appointment and come back and see me again when you bring Max in for that vaccination, well, it'll give us more time to talk then.
Yes.
There are several things we could try. And in fact, we've just started a self-help group. But look, we can talk more about that when you come back.
Yes.
Is that all right?
Yes, it sounds lovely, because I think I just need some help.
I'm sure we can get it sorted out. So, if you make an appointment on your way out and come back in 3 weeks' time,
Oh, good.
I'd better just make a note of that to remind me.
The doctor can put reminders and recall dates into the system.
Thank you very much.
So you can see the computer makes it much
Bye-bye.
easier
Thank
for you to
you.
carry out screening
Say bye-bye,
programs
Max. Good boy.
and makes it more interesting for patients.
Mind the door.
It helps you to become more efficient whilst at the same
Bye.
time improving relationships with your
Hello,
patients.
I'd like to make another appointment to see
Yes,
Dr.
when
Hutchinson. 3 weeks' time.
3 weeks' time, right. 3 weeks' time, that's the 17th of December. That's a Friday at 10 o'clock with Dr. Hutchinson. Is that all right?
Yes, well, a bit early if I could, please.
9:30, is that all right
Yes,
for
that's
you?
fine, thank
Can I have
you.
your name?
Yes, Mrs. Pauline Johnson.
Yes. And what's the address?
29 Woodrow Drive.
Right, I'll write that down for you.
Thank you.
Okay, then.
Thank you very much for your help.
Bye-bye.
Bye-bye.
General practice computing has come of age. This program demonstrates some of its benefits. The AAH Meditel system is designed for easy use. The computer in the consulting room gives
There
you
we are.
fast and safe prescribing.
Thank you, Mrs. Grove.
But it's over 6
Allows you
months since we
access
last
to the
saw
information you need,
Right.
organized in the most
Seems as if you've had
appropriate
quite a
way,
lot of trouble with them in the past.
I've got no
and
record
enables
whether or not
efficient
you
and
smoke.
comprehensive screening. It is an effective and simple tool for helping you manage your consultations and improve the health care of your patients.